My name is Vini Mahajan. I am Secretary in the Department of Drinking Water and Sanitation in the Ministry of Jal Shakti, Government of India. And on this occasion of the Global Handwashing Day, I want to appeal to all of you to please keep your faith and focus on the need for ensuring that we all practice hand washing at all times, including and especially during and after toilet use and before eating our food, before cooking meals, and for people engaged in healthcare and other activities. There are many other times when they must ensure that they frequently wash their hands to prevent the spread of communicable diseases. We know that we all realize this, the importance of this during the pandemic. We must, however, keep in mind that it's not just for preventing spread of COVID-19. For a lot of communicable diseases, especially relating to stomach ailments like dysentery, we do need to make sure that our children, our families, our colleagues all keep the focus on hand washing. We know that water, sanitation and hygiene are linked. We are aware that the global community through the Sustainable Development Goals, the SDGs, has focused on providing safe water and sanitation to all by 2030. I'm very pleased that India has prioritized this effort, and we intend and expect that well before that deadline, India will achieve that goal. We know that on the call of the Prime Minister in 2014, the country prioritized the open defecation free status for all. Toilets were made, behavior change encouraged, and huge efforts made to make sure that there was no open defecation. We have to make sure that we sustain that status going forward. Whichever families need toilets, new families, migrating families must have access, but most importantly, the required behavior change communication must keep going for the sustained use of toilets. But we are going beyond that, because sanitation is more than that. We are moving towards complete solid and liquid waste management, not just in our cities, but even in our villages. So by now, large numbers of villages have made arrangements for door-to-door collection of waste, for its proper management, for grey water management and other liquid waste management efforts. We are very pleased that out of our almost 6 lakh villages, well over 75% have already declared that they have moved beyond the ODF status and towards ODF plus, and we are hoping that very soon we will see model villages across the country in large numbers. We also know that drinking water is essential for good health. What is also important for sanitation, because toilet use is linked with availability of water on premises, but clean drinking water is in itself as well linked very closely with better health. We know from WHO estimates, we know from the assessments and studies done by others such as the Nobel laureate Professor Michael Creamer, that even in India the studies have shown a huge reduction in infant mortality of the extent of well over 25% can happen just by the provision and use of safe drinking water. So we know that there is an opportunity to save 136,000 lives, child lives every year. We know that there are possibilities of saving lives and disability, and thereby costs incurred by families in healthcare through the provision of clean drinking water. So that's what the Jal Jeevan Mission and the Amrut efforts are moving towards. Almost 70% of rural households now do have this access in their homes to clean drinking water. Efforts are on at a war footing. I hope each and every citizen of this country will continue to remain engaged with the efforts towards water, sanitation and hygiene. The wash sector is so critical for human health, dignity and well-being, and of course we will thereby ensure that we achieve the SDG 6 well before the stipulated time.